We are getting a clearer picture tonight of just how busy a summer it was for our city's emergency room doctors and paramedics in battling our city's growing opioid overdose epidemic. Visits to emergency rooms like this one were way up, and that is starting to take its toll on those tasked with saving lives.
Well, anecdotally, we're now seeing about anywhere 2 to 4 overdoses a day over the summer, and typically we would have seen maybe 2 or 3 in a week over the last 2 to 3 years. So this year has been a marked increase in the number of opioid overdoses.
The province started monitoring emergency room visits for suspected drug overdoses in May. Now take a look at some of these numbers. From 273 in May to almost 400 in July, and the data we've received for the first 3 weeks of August suggests last month was also a disturbingly busy one for Toronto hospitals. Dr. Glenn Bindier with St. Mike's Hospital says the average overdose patient requires a service of 2 ER doctors and 2 to 3 nurses for a minimum 3 to 4 hour visit, and sometimes longer if the patient requires multiple doses of the opioid antidote naloxone. He says while wait times are not being heavily affected, it is taking a toll on the city's paramedics.
Just the increased number of patients transported is putting a bit of a strain on the system.
Are we reaching a level where it's starting to disrupt service?
I wouldn't say it's disrupting service. Anytime that there's an increase in any sort of medical issue in the community, whether that be an infectious disease outbreak or things like increases in substance abuse, it does create a burden on the Toronto paramedic service. And it's very emotionally draining on the paramedics because they're called upon to respond to these patients who are essentially in a coma. Some of them die on the scene, and it's very taxing for them.
Now, this graph really shows the increased burden placed on Toronto hospitals from 2015 to 2017. The blue line showing the number of emergency room visits due to opioid poisoning per month. 2017, without question, the busiest year yet. Now, we asked Toronto EMS whether they are too seeing increased wait times due to all the increased calls. However, they deferred all questions to Toronto Public Health today.